Minnesota has more than its fair share of sort of golf addicts, if you will, and so we get a lot of questions about my return to golf. So with hip replacement patients, I generally will let the hip replacement patients, if they come in at their 2-week visit and they're not on any assisted devices, they're not on any narcotics, they have good control of their body mechanics, their leg, I think it's okay for them to do a little chipping and putting even that soon. I like to see my hip patients work on core strengthening exercises. I think a lot of patients that have degenerative disease processes in their hips generally can't do core exercises as well as they should, and so they're underdeveloped or weak there, and that can set them up for recurrent or different types of injuries. So I have them work on core exercises, and then usually by 6 weeks I let them start swinging a golf club. I usually have them advance just as they feel comfortable. I've had some patients play rounds of golf as soon as 6 weeks after surgery. I've had others that typically take longer, up to maybe 12, but I think most patients are again back on the course feeling pretty comfortable by 12. We do have some physical therapists at Twin Cities Orthopedics that are trained in this Titleist Performance Institute, and they have really helped some of the patients. I think one of the things you need to remember is when you take somebody who's had a very stiff arthritic hip and you loosen it up, they're going to be able to make a different turn or movement on the ball, and so they kind of need to almost a little bit of a reset or a refresher course on this is the new normal for you. So I found it beneficial to send those patients for at least 1 or 2 visits. I think the patients have found it beneficial, and it's kind of an open dialogue between me and the patients as far as where they're at. Walking the course is controversial in some ways. I generally tell the patients if they feel like they can walk the course, they can. Some surgeons have recommended that they take a cart for at least the first 6 months to a year. Knee replacement patients, a little bit different kettle of fish. Knee replacement patients tend to have a little bit more pain. The recovery tends to be a little bit longer. So at 6 weeks, most of them are still a little bit painful, but should have reasonable return to function. So I'll let them start chipping and putting and then just gradually advance from there. Some of them, again, can go back to playing as soon as 6, 7, 8 weeks, but a lot of those patients tend to be closer to that 12-week mark, in my opinion. Again, I usually advise the knee replacement patients to take a cart for a longer period of time just because it does tend to be a little bit more painful surgery, but hopefully they can get back within about 12 weeks where they feel reasonably comfortable on a golf course or on a driving range working on their game. Again, Titleist Performance Institute and the PTs, when your knee is arthritic or markedly bowed and you've changed and straightened that leg, it changes the whole setup. And so having a couple visits to work on that new normal is very beneficial to them.